Okay, so a couple things to keep in mind. First thing I'm going to do is to look at that pH, right?
Mm-hmm.
Okay. If the pH is completely normal, what two things have to be true? One of two things have to be true. What are they?
Compensated or normal.
Okay. So if the pH is within normal limits, but it's like barely within normal limits, like if you saw something like this, okay, can this be fully compensated? No, because it's not within normal limits. Can it be a normal ABG? No, because it's not within normal limits, right? What's a normal blood pH?
3.5.
Okay, so we know that it is, we could rule out fully compensated, right?
Mm-hmm.
We could also rule out normal. So something's going wrong with the patient, yes?
Yes.
Mm-hmm.
Okay. So in this case, you're going to start with number 1 again. What was number 1? First step.
pH.
Hmm?
pH.
Okay. Is the pH high, low, normal?
Low.
So what are we in?
Acidosis.
I'm going to take the same example just for now, okay?
Mm-hmm.
If the PaCO₂ is low, you automatically know it's,
Respiratory.
okay, we're part of the way there. If every single number is off, okay, then it's got to have some kind of compensation, okay?
Mm-hmm.
So in this case, the rest of the body is compensating, like your kidneys are compensating. We know that because they raised up their base, right? Okay, they're trying, but they can't quite get you where you need to be. So they are compensated, but only partially because we're not within normal limits. Okay, so this would be respiratory acidosis partially compensated. Okay, so let's go back. Okay. Remember how I told you if your pH was within normal limits, one of two things have to be true, fully compensated or normal.
Mm-hmm.
If your pH is barely off, okay, barely off. If it's just a tiny bit, like let's say this is, okay, barely off.
Yeah.
Okay, so you know like something is going on. It obviously cannot be a normal ABG and it cannot be fully compensated, so y'all can roll those out.
Mm-hmm.
At this case, one of two things have to be true if it's barely off. Okay, it's either just a flat out abnormal ABG or it's a partially compensated. Now, how would I know the difference? Okay, I'll tell you. If only one is wrong, like just the PaCO₂ is off,
Mm-hmm.
okay, or just the HCO₃ is off,
Mm-hmm.
then that's just an abnormal ABG, and you do like we just did at the beginning: respiratory acidosis, metabolic alkalosis, blah blah. It's exactly that's how we already practiced it, right? Okay. If all of them are wrong, every single one of these is wrong, they're all off, then it's partially compensated. Does that make sense?
Mm-hmm.
Okay. So, huh?
This one you need to write down.
Yeah, y'all write down everything because you can start from the very beginning and look at the pH. The pH will tell you so much about what's going on with your patient, right? Like for instance, let's take these off. Okay. Where'd that even go?
It's in the little, like, it dropped in the little, yeah.
Wow, that's wild. Okay. All right, let's say what two things could be true? Just getting this and that's it.
7. Fully compensated.
It's either fully compensated or
Totally normal.
that's it. Okay? If all of these numbers were normal, then
Normal.
it's a normal ABG. If all of these numbers were abnormal, then it's
Fully compensated.
that's it. Fully compensated. That's easy, yes? Okay. What if I change this? Okay, what two things could be true about this number?
Abnormal or partial?
It's either an abnormal, like a normal one, or it's partially compensated. How do I know the difference? What if PaCO₂ is off, but all the rest of them are normal?
It's just a wrong.
It's just an abnormal ABG, right? Okay. What if all of these numbers were off?
Partially compensated.
That's it. It's partially compensated. Do y'all understand now?
Mm-hmm.
Okay. Should we practice one?
Yes, please.
Okay. Okay, so big take-home points to remember. Start with your pH because that will tell you a lot. Once you kind of figure out what your pH is doing, if I give you a PaCO₂, always go to that one. Because if the PaCO₂ is normal, then it's metabolic.
Is it ever going to be over? Like over 100?
Yes, it could be. But even then, it's not really that exciting. Only if it's below 80 is it a respiratory problem.
Okay.
Okay? All right. Let me think for a minute. All right, y'all do this one. What you got?
Metabolic acidosis, partial compensated.
Is it partially? How close is the pH?
It's kind of far.
That's pretty far. So it's just a normal, like,
Uncompensated?
metabolic
It's metabolic acidosis.
acidosis. It can only be partially compensated if it's like barely like one teeny tiny little number off, like 7.34 or 7.46. Something like that.
So it just straight up metabolic acidosis.
So, but if it, let's just say it was 7.34,
Mm-hmm.
it would be metabolic acidosis, partially.
No, because even that they would all have to be wrong. All of the other ones would have to be wrong.
And
Okay.
24 is not wrong.
And 24 is not wrong.
Okay.
So if y'all have one normal limits, then it's just an abnormal ABG, just a regular run in the mill abnormal.
Okay.
Would you say uncompensated? Would you say uncompensated?
Yeah, it's not compensated.
Okay, but like that's something like that. If they ask on like an exam, like is this compensated or uncompensated? It would be
Yeah, it would
un-
have because the pH is so
Okay.
off. Yeah, it's not even part of the way.
I just wasn't sure if that was something like we had to throw in there as part of a